Now, on page 242, we talk about various kinds of antiemetic drugs. There are three major types of antiemetic drugs, just generally speaking. Drugs that restore and help maintain the whole entire lining of the GI tract. Drugs that kind of cut down on the acidity of the inside of the stomach and cut down a little bit on the motility, because a GI tract that moves too much is going to move substances through it more quickly than we'd like. And medications that can cause a laxative effect on the colon. We also have a number of miscellaneous medications, and these are the ones that many times we were talking about when we talk about antiemetic drugs. We have serotonin receptor antagonists. If you remember when we talked about migraines, we talked about serotonin receptor agonists that increase the amount of serotonin available. Here we're going to be talking about drugs that decrease the amount of serotonin, because too much 5-HT3 or serotonin can cause a sensation of nausea and perhaps vomiting. Substance P antagonists is another category of drug. Phenothiazines, which are dopamine antagonists. You might remember the term phenothiazines when we talked about antipsychotics, because remember, antipsychotic drugs are dopamine antagonists. So phenothiazines can fit into that category too, but they make very good drugs for nausea and vomiting. Cannabinoids, everybody's ears perk up when they hear that, but it's not very exciting. Promotility drugs, butyrophenines, and butyrophenines, and then anticholinergics. And of course, we know where acetylcholine kind of falls. Acetylcholine helps promote proper GI functioning. So if we want to slow things down a little bit, we're going to use an anticholinergic, which has the opposite effect, as we remember. All right, first category of drugs we're going to talk about, and this is found on the table on page 243, is serotonin or 5-HT3 receptor antagonist. The prototype drug is a drug called ondansetron or Zofran. Zofran is the trade name. This is a very, very good drug. I remember when it was first introduced, and it was mostly introduced for patients to take care of the miserable nausea and vomiting from chemotherapy. But now it's used pretty readily in other types of nausea and vomiting as well. So what the serotonin receptor antagonists do is to try to either cut down or stop completely nausea and vomiting by blocking serotonin receptors in the intestinal tract. There are also serotonin receptors in the chemoreceptor trigger zone. So if these drugs can block serotonin from getting into these receptors in the brain and the GI tract, serotonin won't activate these receptors, and so that helps cut down on the nausea and vomiting. And this is very effective after cancer chemotherapy, after radiation therapy to the GI tract particularly, and the nausea and vomiting that you can get from anesthesia after surgery. Zofran works really, really well. Zofran can be given IV or it can be given PO. It can also be given IM. The common side effects of Zofran and other serotonin receptor antagonists can be dizziness, headache, and drowsiness. Those are the side effects, real normal. Doesn't make you quite as drowsy as Phenergan, but it can still kind of lull you off to sleep a little bit. Adverse effects would be allergic reactions, which of course we could have with any drug, cardiac dysrhythmias, or ultimately renal or liver damage. Very rare, but if you're taking a lot of it and you are susceptible to it, you could find out that that is an adverse effect. Interactions with serotonin receptor antagonists, we've got the MAOIs, which we remember, they interact with everything. Morphine, because morphine increases the amount of serotonin available. That's part of its effect. And then serotonin reuptake inhibitors like Prozac can interact with receptor antagonists. If you take Zofran with a phenothiazine such as Phenergan, you can cause cardiac arrhythmias. Notice this is in red, so, you know, this could be seen again, possibly, just saying. What we as nurses have to remember and tell our patients is that these drugs can cause dizziness. So if you give a patient Zofran, he should stay sitting or lying down. Tell him to call for help if he's in the clinical setting. You try to give it before vomiting starts. If you have a situation where you know this patient's going to be getting chemo or getting radiation, or, you know, they're coming back from and they're getting into post-op, give this medication before they even have a chance to get nauseated. You want to watch for other drugs that increase serotonin. Usually these drugs are given IV, although, like I said, I've seen it given IM, and they have little dissolvable Zofran tablets that are really nice if you've got some kind of a GI bug and you don't really want to swallow anything. It can dissolve in the mouth. Patient and family teaching are found on page 245, so make sure you look over those. The next category is a category called the substance P neurokinin 1 receptor antagonist. Substance P neurokinin 1, so sometimes they're called NK1. Big old long name, big long name. The prototype drug is a drug called aprepitant or Emend, and I have personally never given this drug, but I'm told it's a good one. This also can be used for nausea and vomiting from chemotherapy and post-op. Side effects generally are going to be fatigue, diarrhea, headache, and dizziness, somewhat similar to the serotonin antagonist. Adverse side effects can be neutropenia. Notice this is in red. So you can lose some white blood cells from taking a lot of this particular type of drug. Angioedema, where the mouth and the throat structures can swell up. Very serious if you can't breathe. Severe allergic reactions, respiratory depression. So these drugs given over a period of time or in copious amounts could cause adverse effects. So, you know, this isn't going to be a drug you just give for any old little GI bug. This is usually going to be given in the clinical setting. It doesn't interact well with opioid drugs. Patient and family teaching is on page 246. At the bottom of page 243, we've got a couple of nursing implications. Always double check doses. And this drug sometimes can be combined with a steroid to make it more effective. Swirl to mix, don't shake. Just kind of swirl it around or roll it gently between your hands. And once again, in red, they tell you that neutropenia can be a common adverse effect. So you think you might see this one again? I'm thinking, yeah,